All right. It's nice to have Dr. Tiberio back. So, I remember last time we talked about proprioceptor, and this time want to start by asking you about like fascia, right? As a strength coach, some the people would like categorize athlete into like fascia based or like muscle based athlete, and which I kind of don't understand like why is there a difference between these two, but um and there's more and more people like look into fascia. So can I kind of share like your thoughts on like overall how you view fascia?
All right, I'll do my best, but based on what you said, I don't think there's a muscle or a fascia approach. At the Grain Institute, we probably call it a movement approach. You know, if you what it needs to happen with the body will happen if we get it moving. But having said that, fascia is a critical tissue that we need to consider for a variety of reasons. But I think you'll find as I continue to talk that the issues have fallen back to what we used to think about before in terms of joints or muscles. Are we looking local isolation, or are we looking more total body global integration? And so I'd like to say that the people who are doing all of the research on fascia for a lot in the last 30 years, particularly in the US with Thomas Myers and anatomy trains, but certainly in Europe, a lot of researchers. The Italians with Stecco and all the people who have done all the research, done tremendous, tremendous service to all of us to provide that information. And as we look deeper into the different fascial lines and what they might call the main lines, and then the spurs or the connectors, um, I believe, it's just a personal opinion, that in with these researchers recognizing all of this information they were getting to, the question rose, well, so what? What are we going to do with it? How do we take advantage of this knowledge to actually train it? To train it when there may not be any abnormalities, but certainly when there are restrictions in the fascia that are going to limit movement and alter the way we do things. And so, and if you look at some of the great researchers who've tried to make that shift, who've tried to go to, all right, what are we going to do about this? That's when they fell into the isolation. Because in their research and trying to isolate all these different bands of fascia, uh, at least from the Gray Institute perspective, they fell into the trap of trying to train that band in isolation. Whereas you almost can't do that because it's connected to something else. And so if you don't put tension in other aspects of it, how are you going to actually train? And in a minute, we got to define what train means, but how are you going to go after that one individual piece? Even though that may be the problem, even though that may be where the restriction is, even though that may be where a traumatic injury tore the tissue and it's scarred down, or even though through surgery that fascia has been cut, we don't believe that you can isolate it. But as I talked about the last time, if you want to isolate it, you have to do it while it's integrated. So we would call it integrated isolation. But let me say something else and see if that throws you in a particular direction. I think the question would be, I would ask you, well, what would anyone mean by training the fascia? You know, and again, from my perspective, it's a little bit of lengthening it because we know that we're concerned about restrictions and not enough gliding and restricting movement. But then there's also the aspect of training it where we need to load it. And you don't necessarily have to go to end range and to the extreme lengthening of the fascia in order to load it. And so we need to lengthen and then we need to load. We need to lengthen so there's gliding and there's no motion restriction, but we need to load it so the tissue gets used to absorbing forces and returning those forces. And we'll see in a minute another kind of pet peeve of mine, and maybe not a pet peeve, but certainly a particular interest, is the information that the fascia provides, not just the forces that it absorbs or creates, but it provides a tremendous amount of information. So let me stop there and say, if anything I've said has spurred a particular question or a way that you'd like me to go, then let's do that.
Nice, nice. So, uh, you said like you mentioned that loading and ex the tissue is extended and loading that like reminds me of like uh track athletes. They do like this med ball series. They throw med ball at each other. They call it a recovery circuit, and we use that like to train. Well, some coaches say that that would probably train their elasticity. So, what are your thoughts on this?
Well, I would agree with that. If you think of what elasticity is, it's the ability of the tissue to lengthen, but then return to its normal state. That's elastic. If you have a plastic deformation, the tissue tears and doesn't return, or it's permanently lengthened and doesn't go back to its state. And so, do we want to train elasticity? We absolutely do for a number of reasons, and particularly as we get older, we lose that elasticity. The tissue becomes less elongatable. It requires more force. It becomes stiffer. And there's a perfect place. It's sort of the Goldilocks thing, too hot, too cold, too compliant or related, lengthening, or too stiff and not lengthening. And so we want to keep that the person we're training in that optimal level. Now, it's much more common that you're going to become too stiff and not elongate rather than the other side of that spectrum. But we still need to be aware of that because there are some people who have connective tissue that's too loose. There are syndromes and diseases and where there's just way too much flexibility. But your point is that you mentioned was that do we need to train this? And I think that's where the lengthening and loading comes in. It's not just a passive lengthening where you would say, well, if I follow this particular fascial line and it went from the toe to the hand, and what would I do to lengthen that in order to give it full lengthening so it glides well? Well, you could do that, but you're not loading the tissue. And not only is its extensibility or its elasticity important or based on loading, but remember, these tissues are alive. And the body will provide more collagen as we lengthen and load the tissues, particularly as we load them. We need to, like anything else, and a ligament that's injured, when it heals, it needs to be under forces in order for the body to know, where to bring the cells, how the collagen fibrils should align. All of that is part of functional training. And that's where we would believe at the Gray Institute that when you try to isolate something out, you come up with these very awkward, not non-functional movements, and they're only loading to some degree that one particular tissue. And we would ask, why don't we do a total body global movement that will lengthen and load that, but it'll be much more like something that's truly an authentic movement, not a movement made up to get after, as I said a second ago, a particular fascial line, but a movement built on what we know as authentic biomechanics and how someone might move in general movement. And at the Gray Institute, we have what we call 3D maps, because those are movements that occur in each of the three planes to generally get flexibility and movement, and we can use them for strength and balance uh, as a foundation. But then we can then go deeper and say, what about for this particular sport, this track event, this particular tennis forehand, the hitting a golf ball? Then we can take and design three-dimensional movements that will get the fascia to lengthen. But again, the loading becomes critical, and one of the reasons is that, as I mentioned earlier, that source of information. There are three different types of proprioceptors, at least three that are in the fascia. And although we're pretty ignorant about what goes on because there's so much more we need to know, we have to assume they're there for a reason. So why would they be there if they weren't serving a purpose? And that information then comes to the is utilized for the body. It's part of creating that proprioception of where the body is in space and how it's moving. And so, and again, I hope I'm not going way off on tangents, but a
Yeah.
friend of ours, Lenny Parasino, who does functional soft tissue stuff and great person, really a great friend of the Gray Institute. He would approach this by going local and global. He might work a local movement, but do some hands-on soft tissue stuff, and then integrate that into a global movement. But he recognizes, as do many people, that everything's connected. So why would we want to really isolate out too much? And so when we start to just look at fascial movements, we want to do things that are three-dimensional. To really take and wind that fascia up, you have to go beyond the three planes of movement. And that's why the 3D maps serves as a foundational and the fascia is being lengthened. But then we take a step beyond 3D maps. We have something called 3D maps fascia. But anyone who works with an athlete in a particular sport can say, where does this person go before they actually do what we want them to do? In other words, if I'm hitting an overhand serve in tennis, as you watch that, where is that place where the body fully loads before it explodes? And we call those transformational zones. And that's where you need the lengthening to occur. And that's where you can go in there and do soft tissue techniques. You can do local techniques, whether it's taping or cupping or whatever. But why not do all of those local techniques while you're considering and positioning the body in all three planes in order to maximize that tension and therefore maximize the efficacy of what you might be doing? But from a strength and conditioning standpoint, if there's no particular injury, well, we want to do lengthening and loading. But what Lenny Parasino would have told us is when you have an injury or a lack of gliding of the fascia, you have aberrant tension, abnormal tension. And you do. And we want to try to restore that gliding and restore the lengthening and so that that tension's not abnormal. But what may be even more important, Eric, is that because of those proprioceptors in the fascia, you also get aberrant information. That the information from those proprioceptors, if they go to the spinal cord and they're providing information how to organize a movement, and when that information's no longer normal because of a injury or surgery or something, now the body has to say, what do I do with all that information? And if we're not training through authentic global movements related to everyday function, as well as the specific activity or sport the person wants to do, there's no way the body can get used to and adapt to that information that's not the same as it used to be. So enough talking from me for a while and see if there are other questions that might have come to mind.
That's awesome. So you talk a lot about information and talk about a lot about like movement. So uh so why do you think there's like athletes that are more elastic and athletes that are probably like not that elastic?
Well, that's a tough question to answer. Certainly, some athletes are more flexible than others. Um, there may be advantages to being more flexible, but again, you can be too flexible. So it's where's that optimum level of storing of energy? So let me go off on a little bit of tangent, but I think it will answer your question and even relate back to your question about training. That there's been a number of researchers, but a famous one from the UK, R. McNeill Alexander, who studied all kinds of animals, not just humans, animals. And he looked at the animals that could really jump well and were really explosive, could load and explode. in terms of their everyday activities. And and what he found was those that jump the highest and can explode the best have long tendons and relatively shorter muscles because it's the energy that's stored in the lengthening of the tendon that's returned efficiently. Now, certainly we have to utilize our muscles and we use energy in muscle contractions. But just think if you had a tendon that became less compliant. So to go through a certain range of motion, now the muscle had to lengthen more than it normally did. Well, now it's not necessarily functioning in its optimal range. That overlap of the actin and myosin filaments within the muscle is now changing more. Creates more loss of energy and it's less efficient. And so when we see different athletes for different sports. But when we look at the humans that really jump, they don't tend to have giant muscles, let's say in their calf, but they have long tendons where they can restore and return energy. Now, it's not just the tendon, that's where the fascia comes in. So the more we can have fascia that will lengthen and store energy and return it more effectively, the more effective we're going to be at executing our movements. As we get older, that compliance in the tendons goes down. That elasticity that you talked about is reduced. Now, in order to go through the same range of motion, my muscles are going to go through a greater lengthening and shortening. And so again, there'll be a little more energy lost. It won't be as efficient because as we talked about the last time, what the body does is it adds only the right amount of active contraction that it needs. Well, if the connective tissue is less compliant and we don't store the energy, then we're going to have to do more with our muscles. Now, I'll throw one more thing at you relative to the way we train and loading. Loading is very important, and let's say for the tendons, because those proprioceptors in the tendons, the GTOs, when I went to school way back when, they said, well, those are protective. When the muscle's contracting and it gets a very high force, and there may be external movements going on or loads, and that is going to create so much tension in the tendon that it would get injured, then that Golgi tendon organ might inhibit the muscle to protect us. So it's a built-in protective mechanism. But that's true, but a limiting way to think about it because those GTOs or Golgi tendon organs, there are different types that have different thresholds. And by threshold, I mean how much force is needed before that mechanoreceptor, that proprioceptor, fires off. And as we train people and add loads, I have no proof of this, but I think what we're doing is getting the body used to the load so it doesn't send any negative impulses. It recognizes that impulse within the range of function for that person. And therefore, that information from the GTO becomes informative. It doesn't become inhibitory. Which leads me to a point I threw in at the very end the last time, is on animals where they've taken animals and they've anesthetized them. So they're alive, but they're looking at the firing of a GTO. Well, when they lengthen the limb, and this was back with the original research, it sends a GTO fires and it sends an impulse that goes to the spinal cord to inhibit muscle contraction. It goes to the motor neuron pool and it doesn't say more, more, more. It says less, less, less. It's inhibitory. So here's where things get really interesting. When later on they repeated a similar experiment, but they put the animal in a weight-bearing position, and then they lengthened the muscle and the tendon fired off, it wasn't inhibitory, it was excitatory. So the same GTO firing, sending the same impulse, but when it got to the spinal cord, the effect of that impulse was different depending on the position of the animal and the need in weight bearing, not to inhibit that muscle so they would collapse, but to enhance the firing of that muscle. And so again, that speaks to why we have to do things functionally. We have to do them in weight bearing. We have to do them in postures that are pertinent to what they want to do. Now, often, not always, that posture is standing, upright weight bearing. But in some of the football players we were watching that have to come down and they roll and they have to move, or they have to move along the line in a crouched position if they're a defensive lineman, well, then we need to train them in that position because the body needs to know what's going to be coming at it, and it needs to learn what that information means, and it needs to use that information to create the best muscular contraction, the best synergies of all the muscles in order to complete the task. Because remember, and you know this, when I think about doing something, whether it's walking, jumping, going downstairs, I don't think about the muscles at all. I just don't. I can't. It would freeze me. I would become paralyzed because I couldn't move. You're thinking of a task. And so whether that's the quarterback throwing the ball or the lineman jumping up to block the pass, that's the task. The ability of the person to do effectively does depend on how we've trained them. And it depends on how we train them under load. It depends on how we train them for quickness and speed and balance and all those things. And so that's where strengthening conditioning can really take advantage of the proprioceptors, the fascia, functional movements in order to really make our training as best as we can. Unfortunately, there's still a lot of things we don't know. So we're going on our best information and watching how the person works and letting the body solve the answer. Because the body, what we're doing in training or assessment or rehab is we're asking the body a functional movement question and we're letting the body answer that question. And if we're doing it in terms of assessment, we're looking at how the body answers that question. Did they use more knee and not their ankle? Did they substitute for a different plane? Did they rotate abnormally in one direction or the other? So we see how the body answers that question, and then we train them so it can answer it even better, even though we don't have the specific answer for that. That's why functional training is so important.
This is really cool because uh the research you mentioned about like Golgi tendon organ, uh what they found when it's not weight bearing and compared to weight bearing, that kind of like in my mind that like I was thinking about like when people talk about hamstring strain, like in research, they always do like Nordic hamstring curl. They say like hamstring is a knee flexor, right? But like you guys or Gary Gray would say like hamstring works in three-dimensional. There's like different function, not just hip flexor. And when the foot hit the ground, everything changes. That's really cool.
It is, and we would be concerned about a lot of this Nordic training and testing. Um, in some case, it might accurately reflect that there is a problem, but it's not a three-dimensional test. It's not done with the foot on the ground. Now, sometimes the hamstrings are working when the leg is swinging through the air, but more often than not, the hamstrings are working when they're on the ground. And it would take probably 20 minutes to figure out, but I can tell by your smile, you already know that not only is the hamstring thought of as a knee flexor, and it can be during running when the foot's not on the ground, but when the foot's on the ground, gravity's going to flex the knee. And so the hamstring, believe it or not, can become a knee extensor, even though it's on the opposite side as the quadriceps. And that's what we call functional muscle function. It goes beyond the structural anatomy. Now, knowledge of anatomy is critical. It's just not enough to understand. And think about it this way for some of your listeners. The hamstrings also extend the hip. We know that. And so do the glutes. And if I were a person who was an above the knee amputee and I had no muscles that I couldn't extend or flex my knee, the hamstrings and the hip extensors are actually knee extensors because if they pull the femur back and the foot's on the ground, the knee's going to extend. And if that's what they do when they contract concentrically and shorten, Well, they're also decelerators of landing. So the hamstring decelerates the knee flexion when you land. It's working with the quads to do that. It's working with all the muscles in the lower extremity to do that. Even the trunk muscles. The old one side of the body, other anatomically, structurally doesn't work. That's the old agonist antagonist theory. And again, your smile lets me know that you realize that doesn't work. And it's one thing to know what doesn't work, but then what are the alternatives? What can we do? And that's where what I was talking about before. If we design and create functional movement patterns and we challenge the body with either load or speed or where in the range or doing it on single leg, the body's going to solve the problem. The body's going to figure out what it needs to do in order to successfully accomplish that task. We're not smart enough to know the answer to that, but we have to be smart enough to put the person in a functional position, use what normally drives it, whether it's the left arm, the right arm, the pelvis, an external load, a tennis racket, a golf club. Use those things that are authentic and let the body figure out how much it needs to contract to decelerate the motion, which is the load, and then how does it transform that load into the explode. And that's something that you've heard from Gary, and we talk about that a lot. But uh, it makes it kind of fun for us as movement specialists if we just take that approach because we don't have to know all the answers. We don't have to know exactly what to do. And we're going to have different clients who respond differently to what we do. And so when we give them an exercise we think that's going to do this, and for 90% of the people, we say that's a good one. But another 10% might go, you didn't react the way I thought. Let me try to change that a little bit. I'll change that movement. I'll do something different. I'll change your starting position of your feet or something like that. And that's really what we think about in the at the Gray Institute. When we're training people through our online courses or our extensive 40-week program, uh, it's it's really not remembering information. It's understanding how to ask those functional movement questions.
Nice, nice. So I want to go back to earlier we talked about fascia, and you mentioned transformational zone. And I remember when I was doing the membership, there's this term called econcentric,
Yes.
and you also mentioned that load explode, and uh, the muscle functioning when you guys talk about econcentrics, all correct me if I'm wrong, but it's also like load and explode, and transformation is also kind of like load and explode. So instead of like uh instead of looking at fascia as like uh different like lines, is it does it make sense to like just look at the whole body like different like transformational zone and mu all the muscle just load and explode with like econcentric?
Well, you've answered your own question, really, because that's exactly how we would say it in that in transformational zones, and all that means is the body starts moving in one direction and moves in the other direction. And if we were going to jump, we don't go up first, we go down first in order to load the system. So as you move and that movement is decelerated, that movement's almost always opposite of what you want to do. Again, if you want to jump up, you go down. Now the great athletes do it faster and quicker and in all three planes than most of us. So they don't have to go through a big range of motion. They can quickly load the system, take advantage of all three planes, and explode dynamically. But the thing about econcentrics is that as Gary and I and many others that we hang out with were thinking about this, you started to say, well, loading is you have to absorb energy. So your fascia is lengthening, but so are the muscles. So if we talked about muscle contraction, an eccentric contraction is the one that decelerates the motion, but uses that energy because the ultimate goal is to transform. That's where the word transformational zone comes in. The ultimate goal is not to just let that energy dissipate, that's been absorbed, but to return it. And that's where we talked about the tendon's more effective at returning it than the muscle. But it's a muscle tendon unit and you're loading to explode. Now, so the lengthening is the E-concentric, the loading is the E-concentric, the exploding is the shortening is the concentric. Okay, so to generate force, you have to shorten. You have to take that energy that's been absorbed and shorten it. And from that level of understanding, as Gary and I were looking at function and how people move, muscles and even fascia are not lengthened in all three planes at the same time. So it was easier when you just thought single plane, but as soon as you recognize that the body's a three-dimensional being and the function is three-dimensional, and you look at what happens in these transformational zones that you mentioned, and you then said, well, what about this particular muscle? Well, it's not always being lengthened in all three planes. And certainly muscles across more than one joint aren't being lengthened at both joints. So it's a lot of talking that doesn't make a lot of practical sense. So let me say that you're doing a single leg squat. And as you go down, your knee flexes and your hip flexes. So what are the hamstrings doing? Well, at the knee, the hamstrings are shortening. So is that a concentric contraction? But as the hip flexes, they're lengthening. So is that an eccentric contraction? And so we had to come to the conclusion and try to figure out if it could be doing it at the same time. And then, so the term econcentric was created. We utilized that. I think Gary came up with that. I don't think anyone's ever used that before. So it's econcentric. So that happens not always, but all the time within the body. It's not a rare occurrence. It's happening almost always. It actually is an advantage to the body where sometimes what's happening as you're exploding in two of the planes or at one particular joint, you're still loading or lengthening at the other one. So that allows you to take that energy of the lengthening, not later on, but simultaneously, that energy is transferred to the shortening, to the thing that you want to do. So it's not a lengthen and load, then explode. It's simultaneously lengthening and loading. And so if you take that hamstring example, that was only sagittal plane. Well, what's happening in the other two planes? If I'm reaching or I'm loading or my foot's doing a rotation that's causing the leg to rotate and the hips internally rotate. Well, now it's being lengthened in all three planes. So I think as complex as it is, it's easier to say this is an econcentric load, what you're doing before you do what you want to do, as you go down before you jump, as you reach back before you throw the pitch, before you throw the ball. So there's an econcentric load followed by an econcentric explode in the transformational zone as you described. It's just not that everything's being lengthened in all three planes and then shortened in all three planes, but things are happening simultaneously that cause the muscle to both lengthen and shorten. And we could say that for the fascia. Now, here's another thing for your listeners to think about. Could one joint be moving in such a way and another joint be moving in such a way that a particular tissue is being loaded but not being lengthened at all? It could be a dynamic isometric. Joints are moving, there's tension in the muscle, but it's not necessarily changing length at the muscle actin and myosin overlap. And that's where the tendon absorption and the fascia absorption all come in. But you could be moving, but if you were measuring the length of a muscle tendon unit from its origin to its insertion, it may not be lengthening or shortening at all. But it would certainly be doing a tremendous amount of work. So the term econcentric is more functional. It means what's happening at that particular time as we either load or we explode. And so it got confusing as I thought about it because, well, is it lengthening in two planes but shortening in one? Or is it lengthening in one and shortening in two as it loads? Is it exploding in two but not the third? And so I think it's as complex as that gets. I think it's simpler to think, what am I trying to do? If I'm trying to throw the med ball, as you described, and when I want to throw it into the wall, I don't start at a point and just throw it. I take it back, I load, and then I throw it, I explode. The change in direction is the transformational zone. There are probably places in muscles and tendons that are being lengthened in all three planes, but I can guarantee you there are many that are going through this concentric load. And if it lengthens and shortens during the load, guess what? During the explode, it's also going to lengthen and shorten. So it's an concentric load followed and transformed in the transformational zone into an concentric explode.
Mm, nice, nice. All right, so a follow-up question by this uh transformational zone is uh maybe I'm wrong, but I feel like a lot of injury happen in change of direction. And is that also like what you guys call transformational zone? If that's the case, like should we pay more attention in like training that?
Again, Eric, you're spot on. That's what we would say. One, not always, but very often the injury occurs in the transformational zone when we try to change direction. Um, should we train more there? Absolutely. And we even have to train in such a way. One of our gift fellows, way back when, who took our 40-week gift program, Steve Stricker, who's trained at multiple levels, college, professional, etc. He called those, and I hope this doesn't offend anyone, but oh shit transformational zones. That, yeah, when something gets out of control and I haven't decelerated something, then I'm in a place where an injury could occur. And we hope that the body can create a synergy that's going to protect the tissues, not let the person get injured, and hopefully still execute the movement successfully. So those are the ones that aren't necessarily normal, but we can be in those situations. So I use this example frequently when I get to talk about proprioceptors and fascia. I'm a basketball player. My teammate has just stolen the ball, so I've reversed direction. I'm heading down court, and I expect to make this layup. And so I'm on the right hand side. I expect the ball is going to come either to my right hand or both hands, and hopefully it's going to be in the right place because I'm about to land on my right foot, and then I'm going to take off and lay it in. But instead of the ball coming ideally where it is, the ball comes way behind me. And so do I stop? Or what do I do? So do I reach? So that's one of those oh shit transformational zones. Because the way I would have trained all my layups would have been normal. I take the ball and so the challenge for us as movement specialists and strength and conditioning specialists, have we taken our athletes into some of these more challenging and dangerous positions and trained them to be prepared for that? Have we purposely thrown them the ball behind them? And so the problem is that in a big game, I have this behavioral driver that wants me to catch that ball, even though it's behind me. My body might be saying, this is not a good thing. Because if you reach back, your abdominals aren't really loaded the way they should be. But even more importantly, your powerful back hip, your glutes, and what we call the back butt has now been shortened. It doesn't have the ability to create the tension. And so all of a sudden, I'm getting information for proprioceptors in my abdominals that I haven't trained because I haven't done layups doing that. So now I'm getting information that I don't know what it means. I have part of my perfect system, the ideal system, the most effective system, my posterior lateral hip muscles that aren't going to be able to do what they're supposed to do. And so now what's going to happen? if it was just a safety thing and I didn't want to get injured, I'd miss the ball and no problem, go back and play another play. But if I'm driven by the importance of this situation and the behavioral drivers are saying, no, you have to catch that ball, now I might sacrifice my safety in attempt to successfully make the layup. And so we have to train people in less than optimal situations by tweaking in certain things out and tweaking out certain things in order to change the way it is. And I don't remember exactly, but I think in our last video we talked about once the person can do it successfully, that's not the end of their rehab. Now they can do it successfully, but now we have to change all the variables in order to make that skill more robust so it can occur in situations that are suboptimal. And that's what we need to do as strength and conditioning people and rehab specialists. You have to go that next step beyond just doing it ideally successfully in the same way. And that's one of the negatives of everybody who's focusing purely on form. I understand the value of form, and I understand getting someone to do a lunge in a certain way that might be ideal and do a jump in a certain way that might make it ideal, but that doesn't necessarily prepare them for when it might not be ideal. And so we have to purposely change the variables in order to give the body the ability to contract. Now, if the body's going to execute that, we have to be very careful as movement specialists when we tweak something, when we change the variables, when we do it and move away from the optimal way to do it. Because those changes need to be subtle. They need to be small. So the body can say, hey, that's not exactly the way I remember it, but no, I can still accomplish this. If we make these tweaks, as we call them, the changes in the variables too big, now it's more likely the person's going to fail, that they're not going to be able to bridge that gap, to be able to take that slightly altered situation and still be successful. And I think that's what happens sometimes. Another simple example is I remember in people getting rebounds that the coaches would always scream, don't bring your hands down. The person would go up, they'd grab the ball, and they say, don't bring your hands down because they're going to steal it. Well, one of the reasons they bring their hands down is they have to flex their trunk in order to load their hips in order to successfully land. And so it's very hard to land with your hands above your head, much more difficult than landing when you can flex your trunk and take advantage of your hips. So we have to train people to land with their hands in different positions. We have to consciously anticipate these transformational zones that might be dangerous, and we have to purposely take our athletes there, not avoid them. It's the old, well, your knee got injured by going in, so you have to avoid that. Train it so the knee doesn't go in. We understand that the person's heart is in the right place. We also believe that they should figure out that that's the wrong way to do it because nobody's knee stays over the middle of their foot when they're running around doing things. And if you train someone just to do that all the time, you're training them for failure when they get out there in the real world.
Nice. I love it. I love this. So, uh, because I was actually gonna ask uh questions about knee caving in. And I remember talking to an athletic trainer. He said back like 2 years ago, he said one of our athletes like shoot the ball, and when he shoot the ball, like his knee caving in, so he's worried about like he tear his ACL. And I was like, some athletes just move like that. They're probably just more elastic, and that's the way how I do it. But so uh and I don't know, I don't know if that counts as transformational zone or not, but how do you manage the balance between like maybe this is a stupid question, but
No, it's
like
not. It's a real world question. It's a real
train
question.
the hip more, train the glute more, and like balancing the knee cave, like how much does the knee cave in?
Great question. and a pertinent one because if the knee goes in too far, and we know that people's knees get injured doing that. But we can watch someone run along and I mean, even watching someone do a road race, you see some people that are really good runners and you look at them and you look at their knees and their feet and you go, wow, I don't know how you can even run. Well, if that was going to be enough to tear the ACL, they wouldn't have got up to being able to run marathons. But there are situations where we want to try to control that. But when you say how much should the knee go in, that's the ultimate question without an answer. But so we would always say it depends. It depends on what task you're doing. If you're doing a straight anterior lunge, the knee should go in a little, but we know we recognize people whose knee goes flying in way too much. We would be concerned about that. Doesn't necessarily mean they're going to be injured, but we would be concerned about that because the forces wouldn't necessarily suggest that the knee should do that. Now, if the person were a soccer player and they landed on their left foot and they cut very quickly, rotated to the right, we would expect the knee to go in a lot. We would not expect it to stay straight because if it doesn't go in a lot, something's wrong. Either the foot's not functioning right or they're fearful of doing that. They've been injured before. So, how much the knee should go in depends on the task or the movement that they're doing and how many friends, like you said, you accurately mentioned we work on the hip. Do we strengthen the hip? Yeah, we strengthen the foot muscles too, because the foot's going to dictate that. We strengthen the core trunk muscles too, because they're going to control the pelvis. And if the pelvis isn't stable, those hip muscles aren't going to be successful. However, you have reached the point where we were discussing before is that we would initially try to add in more hip and calf and trunk and do a movement that would reduce that knee motion. And we would see, does it still reduce? It should reduce. And if it still went in, we would even be more worried about that because we've done things that should drive it out and it's not going out. So we would be more concerned. But even if we wanted to say, let's try to prevent this, we don't know if they're going to get injured, but let's really build up their hip. And as we train the hip and train the calf and train the trunk, what happens is you see that for the same movement, the knee goes in less. You go, wow, that's good. That's a good thing. I think that's, we're not preventing it from going in fully. We're just reducing that. We're taking them away from the injury transformational zone. We're giving them a little buffer, even though we know their knee's going to go in and we know it should go in because the knee has to go in order to load that hip. If the femur doesn't go in, you're reducing the effectiveness of the hip muscles. So we expect it to go in. And if we can reduce it a little bit, as I said, take them away from the buffer, the injury zone, give them a buffer. But then the second half of the training has to be taking those friends out, tweaking the movement in such a way that what you gave them before, you're taking away because they're going to be in that situation where that happens. So, again, that basketball example, if I land on my right foot, but all my training has been to allow the trunk to lean, to reach with my left hand over to the right. That's lengthening all the hip muscles, making them more powerful, protecting the knee, doing all those things. That's a good thing in training. That's a good thing in rehab after injuries. But that's not the sport they're going to play. And so once we get them to be successful, purposely tweaking in what we would call friends, then we have to have that same program to gradually tweak them out if we really want to reduce their chance of injury.
Hmm. All right. Last question before I let you go. Uh, you mentioned like motor learning and rehab, like putting athlete when it's rehab situation, putting them back to practice earlier so they can train their proprioceptor. They can like train more functionally. So in research, let's if it's ACL, the ACL won't go back to after ACL injury, the ACL won't really go back to like a ligament after 2 years. And so what I think what NBA is trying to like push the recovery like timeline longer and compared to like NFL, they're trying to like push the athlete back faster. Like they try to go back to like probably somewhere around 8 months. Do you think that maybe compare like football to basketball is like not comparing apple to apple, but let's say overall like situation, if it's both non-contact injury, should we like push him back faster, train the proprioceptor, train the brain, the function, and will that help them like perform better?
Well, first of all, we have to ask why is one sport thinking they have to do it differently than another? Um, so we would say no difference. Training ACL prevention, injury prevention is the same as post-rehab and post-surgical, and it shouldn't be any different depending on the athlete. Now, it may be different depending on a particular athlete or the demands of their sport or even their particular position, but we wouldn't believe that you slow some people down and you speed others up. There is, as you mentioned, this challenge of, well, when is the ligament truly a ligament again? And it's going to take a long time. And so if we waited till that occurred, as I mentioned the last time, we'd be waiting a long time even to begin the therapy, never the rehab, never mind when they can go back and play. The other thing you have to realize is, and Gary Gray would say this, he would try to rehab them even after surgery as if there was no ACL there. That he's going to rehab them so that he's just doing all the things that he needs to do to protect the knee. And by protecting the knee and allowing it to load and explode, to go to those transformational zones, but then come back, he's doing that person a big favor. I'll be honest, and when I was, and this is a while ago, when I was training a lot of ACL people, after surgery, or even after what they call the partial tear, which they say there's no such thing now, but if you, I could get them back functionally doing everything, but what I was doing was bringing in all the friends. I was making them very functional, but I hadn't done the second half of what we described as tweaking all the friends out so the quad can build up. Because if you tweak all the friends in, the quad won't build back up its girth, it's the muscle fiber size, its strength. So if you're going to train someone early on following ACL or in really anything but ACL, if it were me, I wouldn't wait till all that tissue is all fixed because you don't know when that's going to be. As we mentioned before, if you're not putting any stress on it, the collagen fibers don't know how to align. The connections between those fibers don't know how to occur. And we don't even know when there's going to be reinnervation of that tissue with nerves that could tell you what's going on. So if you have no nerves telling you anything, the question is, what are you worried about? Well, you're worried about a re-rupture. Well, what's going to cause a re-rupture? Well, we would say you're more likely to get a re-rupture if you train with the knee going straight and not letting it go in and wait too long and let the proprioceptors decay and do all that. The longer you wait, the longer it's going to take. So it's sort of like even Gary would say in an ankle sprain. If you put it non-weight bearing for 2 weeks, you've doubled the time it's going to take to get back. So if you had a goal of 8 months, then you need to get that person going sooner and faster, but you need to have someone who knows how to tweak in and tweak out. You need to do all the things at the right time. Just can't put someone through some time-driven protocol because this person's an individual. So protocols can be helpful in terms of giving general ideas, but these ones that say at this week you do this and this week you do that, well, that would work great if Mr. Joe Average came through the door, but some people are going to come back faster and some people are going to be slower. And if we don't base our rehab program on what they're already doing successfully, and then know what's the next step now that they're doing this successfully, we're just randomly applying an average program. And so, you know what happens? Because it's average and it's not for everyone, and someone has a little setback, they go, oh, that's too aggressive. No, we need to slow down. We need to back off. We can't do that. No, that's because they didn't consider the individual. They didn't base their rehab on what the person was actually already able to do. And so that's why it has to be individualized. But the sooner we get them going, the faster they come back. Now, the ultimate answer to your question is, why would one be concerned more than another? Well, you have to ask what are the statistics on re-rupture of an ACL? That happens, but and I'm not following this regularly, but I don't hear about that a lot in the news with athletes. Well, they tore their ACL and they re-ruptured. Sure, they did, but it's not the most common thing. Now, sometimes they'll get other injuries because they were waiting too long. They didn't train the system. They were non-weight bearing too long. So they go from, as soon as they start to rehab, they get Achilles tendonitis because they let that, atrophy because they weren't doing the weight bearing. They weren't doing the things that needed to be done. And so uh, I personally would still be as aggressive as I could be without doing any harm. That's one of our rules. But how aggressive you can be depends on that client and what they were like before the injury, how long between the injury and the surgery. So as soon as we have a general structure and we individualize it for that athlete, that client, and we know functionally how to tweak, we can be real aggressive. If you don't know how to tweak and you don't know how to get away from the paper that's written out on a timetable and base it on the individual, then you're going to have to be more cautious because you're going to get some negative responses because you're following a rigid protocol. I don't care if it's fast or slow, if it's short or long, some of them you're wasting the athlete's time because they could be coming faster. And in some of them, they're going to have setbacks because you haven't based it on the individual.
Nice, nice. Man, I still got a lot of questions, but I'm gonna let you go. So for those who are interested in what we're talking about today, for those who are interested in like the chain reaction biomechanics and proprioceptor talks, where can they find those videos, education stuff?
Well, I'm going to say they go to grayinstitute.com. Um, but um, there's a lot of content on there. And I would probably suggest that we have specials all the time for a 1 year commitment to get into the membership as you did, and then find out where you go. But we're adding more and more stuff all the time. We have specific CEU courses, but there's a lot of just general information about the proprioceptors, about training, about ACL, about, Achilles. We do free webinars there's a lot of free Gray Institute webinars on Achilles tendonitis or stuff like that. And so, we're not the only ones that have great information, but if you go there, you'll certainly find the approach that we call applied functional science. It's based on science, it's determined by function, and it's applied to the individual.
Nice, nice.